chambers around the state have been engaged with the hospital community to make the case for it. And that is the fact that the charity care we're all providing, and in INOVA in 2012, it was $120 million out of the $600 million of all hospitals in the Commonwealth. So given those numbers, you can see from Dr. Lee's presentation, whereas UVA and VCU get reimbursement from the state, INOVA doesn't get any of that. We get very few dollars. So all of those costs for charity care at an INOVA hospital, at Virginia Hospital Center, Arlington, are being really passed on to the business community. The business community pays for that charity care in the form of higher premiums for their employees or for their executives. And so it's a very simple business case, and yet you wouldn't believe the challenge it is to get even many of the chambers around the state engaged in this issue, because many of them are Republicans, Republican backgrounds. Chambers have been traditionally Republican. So it really comes down to almost a political reason why we're having difficulty convincing a lot of the House members to be supportive of Medicaid expansion. Just very briefly, I want to say for INOVA, when Alfonso talked about smaller hospitals going out of business, potential of going out of business, the reason that will happen is because primarily they have a patient population base of Medicaid and Medicare. Neither of those programs pay full cost of providing coverage. So what happens in a case like at INOVA, and most of the Northern Virginia hospitals, probably 35% of our patient population is a combination of Medicare and Medicaid. The remainder of that are private pay patients, people who come in, receive their care, and have an insurance cover. And the difficulty for INOVA will be with this cut that we're taking. On INOVA itself, in 2016, we will lose $50 million in federal reimbursement for Medicare. So Patrick has alluded to the linkage between, if we don't expand Medicaid, we lose $100 million from not expanding the Medicaid program. That's a $150 million turnaround. Now for a small hospital, that's significant. It could be $1 million. It's life or death to them. For us, it will mean cutting back education programs, probably research, and ultimately capital dollars that go into building the buildings that you go to when you need hospital care or when you need an MRI or CT scanner. They just won't be replaced as often. It won't be the most modern equipment. So our challenge is, in working with our delegation, is convincing that other side why Medicaid expansion, closing the coverage gap, whatever terms you want to use, is good for business in Virginia and not just for the hospital community. It's good for everybody.